The death toll from the new coronavirus has jumped in Italy overnight, and the number of infections is rising fast in Germany too. Governments across the world are taking different measures to contain its spread, as well as some around panic buying. The World Health Organization has demanded an end to the hoarding of protective medical equipment, and France is now reacquisitioning all stocks of masks in the country to ensure that they go to the patients and health workers who need them most. And while many people across Europe have been on the hunt for hand sanitizer, in Australia or here in Hawaii, people have also been stockpiling toilet paper. Now, the number of virus patients dying of the virus in Italy has jumped, as I say, overnight and has risen now to 79, more than anywhere else outside of China, according to official data. Evelyn Laverick has the very latest.
A military hospital in Milan is made ready to receive some 60 convalescing coronavirus patients. Pressure on health facilities is intense as Italy wrestles with having the biggest cluster of cases in Europe. Another quarantine red zone is being considered in the town of Bergamo, 50 kilometres northeast of Milan, as the number of infections there increase. In neighbouring France, around 120 schools have been ordered to close, most in Brittany and the Oise region, which have been hard hit by COVID-19, the disease caused by the new coronavirus. Anxiety has led to panic buying. President Macron has requisitioned current and future protective masks in order to ensure they get to virus patients and health workers. From the French Health Ministry's crisis centre in Paris, the president warned determination was needed to fight the virus.
We must all be aware that we are and will be mobilized for the long term. But you're ready, and I know that we will have the strength to meet this challenge.
The WHO has warned that the virus is not like flu.
While many people globally have built up immunity to seasonal flu strains, COVID-19 is a new virus to which no one has immunity. That means more people are susceptible to infection.
Many of those cases are in Iran. Nearly 10% of the country's lawmakers are said to have been infected. The country so far stands alone in how the virus has affected its government. In a further effort to combat the spread of the new disease in crowded jails, the authorities have temporarily released more than 54,000 prisoners. The inmates were tested before being released on bail. Meanwhile, President Trump has visited a lab to see how researchers find cures. Despite his public reassurances, there has been a further death from the virus, and tensions are rising in Congress over government's ability to speed up testing. Evelyn Laverick, euronews.
Well, so far in Europe, some 2,500 people have tested positive for COVID-19. The most affected countries are Italy, France and Germany. Well, the health minister warned last week that the outbreak seemed to be turning into an epidemic spreading nationwide. Well, let's go to Berlin and speak to our reporter Jessica Saltz, who is there. Jessica, first of all, just talk us through these new figures, this new spike in numbers that we've seen in Germany today.
Well, Darren, the new figures that have just been confirmed is that 240 people have been confirmed to have the coronavirus in Germany. Now, the vast majority of these cases, 111 people with coronavirus, are in the western federal state of North Rhine-Westphalia. But this is a disease that has spread from a virus that has spread across the country from 3 federal states last week to 15 out of 16 German federal states. Here in Berlin, 6 people confirmed to have the virus and around 200 people currently here in quarantine.
Now, the German health minister, I think, has been meeting some of his counterparts across Europe. What measures are being taken there and indeed elsewhere to try and combat this virus?
Well, because Germany is a federal country, much of its health system is decentralised, and that's why this meeting is so important today between Germany's national health minister, Jens Spahn, and also the various health institutes and medical institutes around the country to make sure they're up to date on how to treat patients for coronavirus, but also critically to this meeting is how to transfer information from local authorities to national authorities when it is discovered that any people around the country have the virus. Germany really seems to be stepping up its process of putting people who may have had contact with anyone who have the virus into quarantine. The message here seems to be very much playing it safe rather than being sorry. So stepping up its quarantine measures, and of course for that, information is critical.
Now, Jessica, the talk of the newsroom this morning has been people in Australia stockpiling toilet paper. What's the sense there in Germany? Are people panic buying? Are some of the shelves empty of hand sanitizer, for example?
Well, Darren, the Germans are quite a pragmatic bunch and generally quite unflappable, especially here in Berlin. So people really seem to be taking it in their stride. I've been speaking to a lot of people who say that they're not going to let it disrupt their daily lives. However, so it is disrupting some people's daily lives because many schools are being closed in Berlin. So, of course, many children having to stay at home. And, of course, entering many supermarkets in Berlin, there are many empty shelves. Hand sanitizer sold out in certainly all the drugstores and pharmacies I've been into. In fact, some of the few that still have hand sanitizer now limiting the amount they sell to each customer. But generally, people here taking very much in their stride, which is what the Health Minister Jens Spahn has told people to do. He said that there's no need to panic and urging people just to generally be cautious.